Curfew violators. Up to now, uh, you said that okay, the AG, Inspector General, is actually going to provide spaces for such people. Where particularly, and what really prompted the government to do so, even after saying that okay, there will be a quarantine in government facilities. And then another question is pertaining to the scientific or the research over the new medication or the medication of COVID-19. Quite a number of countries across Africa, particularly Madagascar.
Yeah.
Madagascar has actually tried to come up with
Sorry, I can't
medicine.
hear you. Louder, please.
Some countries in Africa have actually also tried through their research to come up with a medication of COVID-19, particularly Madagascar. Maybe as a country, how far is KEMRI in their research in terms of identification of the new medicine for COVID-19?
Okay, thank you for another opportunity. I have a set of three questions. One is about what is the situation in refugee camps, and two, what about how are you handling cases that involve children? And number three, we had the issue of allowances that other healthcare workers claim that government has decided to only give doctors and not the other cadres. Thank you.
Okay, thank you. I think I'll start with the question regarding the curfew violation. I think yesterday, after the NERC meeting, Kas Rashid was able to share instructions to the IG on how we would avoid the use of quarantine facilities for holding curfew offenders. One, I'd like to report that the report we're getting back from the IG is that, in fact, Kenyans, fewer and fewer Kenyans are violating curfew, and so the numbers are reducing. And number two, to remember that, one, quarantine is a public health intervention. Quarantine is not supposed to be a punishment, and therefore that is why that deliberation and position was attained yesterday. And so going forward, I'm aware that the IG and his team are working on ways in which they'll be able to contain curfew violators, and this will also include perhaps a judiciary process, and this shall be shared with you in the coming days. Concerning countries in Africa who are looking at different modalities, I think the DG, the last time we were here, was able to elaborate on different trials that are going on across the country. He gave good information on the drug that was under approval in America through the FDA. And yes, of course, we've heard of the different cures from Africa, Madagascar, and the different countries who have different medicinal products. What we're doing is that through KEMRI and through established systems and protocols within the country, there are mechanisms in which to look and evaluate. Of course, we promote Africa and ingenuity and innovation in Africa, and that is something that requires to be celebrated. However, it's important that that celebration occurs under protocols and guidelines through which such drugs have been evaluated, especially for safety. Remember, at the end of the day, a drug comes into your body, it does something in terms of curing, but drugs also have side effects, and therefore there has to be a rigorous protocol put in place to evaluate this. DG will speak more on the different clinical trials that are underway in the country and those that we foresee in the coming future. Regarding the situation in refugee camps, we are working collaboratively with different agencies and government MDAs who work and ensure that refugee camps are well manned. We have seen, and I think this was highlighted in one of the past statements, that there may be challenges in some camps, but these are being addressed, especially with collaboration from our UN partners to ensure that conditions there are safe and that also containment measures are met in those camps. And perhaps in the next few weeks, we might be able to give you a detailed report as to how we're doing that.